Heading to the doctor's office or clinic can already feel like a daunting task, especially when we're not sure where to go for what we're dealing with. When dealing with medical issues, whether severe or minor, it's easy to be confused about the whereabouts of which treatment centers and clinics we should use and what is covered. That's why today we're discussing Know Before You Go. Hello, all. Welcome back to Thoughtful Thursdays. I am Johannes, your on-site life coach. January is Preventive Care Month. As we close out Preventive Care Month, we want to help create further understanding of where to go when you need medical care. Here are 4 tips to know before you go. One tip to know before you go is about emergency room visits. The emergency room is for immediate treatment of critical injuries or illness. If a situation seems life-threatening, call 911 or go to the nearest emergency room, open 24/7. Some of the conditions that may be treated in the emergency room are sudden numbness or weakness, uncontrolled bleeding, seizures or loss of consciousness, shortness of breath, chest pain, head injury or major trauma, blurry vision, severe cuts or burns, or an overdose. Emergency room visits are often associated with higher costs than urgent care or preventive care doctor's appointments. But this shouldn't deter you from going to the emergency room for emergency needs. Though no appointment is needed, wait times may be long, sometimes averaging over 4 hours. The next tip to know before you go is about urgent care centers. The urgent care center is for conditions that are not life-threatening. It is staffed by nurses and doctors and usually have extended hours. Some of the conditions that may be treated in the urgent care center are minor cuts, sprains, burns or rashes, fever and flu symptoms, headaches, chronic lower back pain, joint pain, minor respiratory symptoms, and urinary tract infections. Urgent care is a good option if you can't get in to see your primary care physician. They can perform diagnostic testing, x-rays, provide medications, and more. Urgent care center visits costs are lower than emergency room visits. No appointment is needed, and wait times vary. Another tip to know before you go is about convenience care. Convenience care clinics help treat minor medical concerns that aren't life-threatening. They are staffed by nurse practitioners and physician's assistants. They are usually located in retail stores and pharmacies such as CVS and often open on nights and weekends. Some of the conditions that may be treated in the convenience care clinic are the common cold or flu, rashes or skin conditions, sore throat, earache, sinus pain, minor cuts or burns, pregnancy testing, or vaccines. The cost at the convenience care clinic may be the same or lower than the primary care. No appointment is needed, and the wait times are usually about 15 minutes or less. The last tip to know before you go is about primary care. Your primary care physician is the best place to go for routine or preventive care, to keep track of medications, or for a referral to see a specialist. Some of the conditions that may be treated by your primary care physician may be general health issues, preventive care, routine checkups, and immunizations and screenings. The cost associated is often a copay, coinsurance, and/or deductible payment. An appointment is needed and thus a shorter wait time in the waiting room than, say, the emergency room or urgent care. But scheduling dates will vary based on both you and your physician's availability. By having a better grasp of what healthcare centers and professionals to utilize, it can help us to limit unnecessary visits and use our time more efficiently. It's important to embrace the benefits of our healthcare and let it serve as the cornerstone of our professional healthcare approach. Remember, our health is our most valuable asset, and it is the key to preserving and enhancing it. We have a few announcements and reminders for you guys. I am hosting a live meditation and deep breathing session on February 6th at 12 p.m. We have a well-informed seminar on Know Your Numbers on February 12th at 11 a.m. We have a Financial Friday seminar on starting early in your career on February 28th at 12 p.m. Our Know Your Numbers campaign begins next month. Be on the lookout for our wellness calendars for when we'll be at a location near you. Thanks for tuning in. Please like, subscribe, and comment. We'll see you next time.